If you're watching this video, there's a video that precedes this one that's just above on the website at ushealthcaresolutions.com. If you're already on that website, then you're on the right spot. But you should listen to the one above this before you listen to this one itself. Let me clear up a couple of things. The $100 that I'm talking about is average. Some is less, some a little bit less, some a little bit more. And that is taken out of your Social Security checks prior to you even getting them. That's the Part B portion that I keep referring to, and that's in place regardless of what you do. There's a section that's right next to this one talking about prescription drug plans, so I'm not going to get into that a whole lot on this one, except to say that your Medicare Advantage plans can come either way. Your Medicare Advantage plans can come with a prescription drug card affiliated with it or without. And that's another choice that you also get to make. It's nice and convenient to have it all wrapped up in one because you have one administrative staff that's taking care of pretty much everything. That's enough about prescription drug cards. Once again, if you want to hear more about prescription drug cards, just click forward to the next page to the other videos and we'll get back to that. But back on to Medicare Advantage programs. There's another group of people out there, just in case you're watching this video, I want to acknowledge you. Low-income subsidies, people that are getting help with their Medicare Medicare premiums. These are people that are below a certain threshold of income. It's controlled differently by the different states, administered a little bit differently, but still controlled under the umbrella of CMS or the government under Medicare. What that is if you make under a certain amount of money, the different states will assist you in different ways. One of the first things that they could assist you with, I'm sorry, that's my phone going off. One of the first things that they could assist you with is that fee for Part B. They could pay for that if you qualify. This other thing that they could do is also pay for all your copays. I was referring earlier that a Advantage program could be viewed similar to an employer's program, but there are some major category differences. First of all, deductibles. Under most Medicare Advantage programs, there are no deductibles for hospital stays and doctor stays. If there is one, it's going to be extremely small, or should be. Once again, depending on what area you're in. And deductibles for prescription drugs, same thing. We'll talk about it in the next category, but very small deductibles. But when we say small, guys, I've seen plans with no deductibles whatsoever, and I've seen plans all the way up to $500, maybe a little bit less than that. But under those Medicare Advantage programs, a Medicare Advantage program typically you can find one that does not have a monthly premium on top outside of the $100. If you're on the low income subsidies, you won't even have to pay that. Most co-pays under the Medicare Advantage programs are somewhere between $0 up to $50 for specialists, and a lot of those are $0. So once again, unlike employer plans that typically always have a deductible, always have co-pays, you don't have that with a Medicare Advantage program, and you can get out of a lot of that by choosing the right one. In addition to, of course, with the new healthcare laws, all your physicals, once a year, annual physicals and exams and all that kind of stuff is taken care of. No deductibles for those at all either. Here's another way of looking at this. Under a Medicare supplement program, if you choose the right one, you'll have a monthly premium, nothing else. No co-pays, not anything. On the other side, you'll have a Medicare Advantage program. No monthly premiums, very small co-pays, and very small deductibles, if any. So you got two different sides. Do you want to make a monthly payment every month if you go to the doctor or not? Or would you rather take up a Medicare Advantage program and if it's only there in case you use it? If you don't never use it doesn't cost you anything. And then you have, of course, like I said, guys, your low-income subsidies. On those guys, if you are low-income, I'm people are in that situation, you can take up different Medicare Advantage programs. Will add to your Medicare and Medicaid. It offer things like still zero deductibles, zero co-pays, all that kind of stuff is zeroed out, but it add additional benefits like testing equipment for diabetes, free trips back and forth to your doctor's offices and appointments, different services, free over-the-counter medication for low-income subsidies. But that's, once again, that's a totally different areas. And if you are on low-income subsidies, I really would ask you to once again put click onto the email link, send me your questions, and I'll talk to you as individual cases, because each one of those cases are a little bit could be a little bit unique. But it doesn't change the fact of what we're talking about here. Last but not least, Medicare Advantage programs. And I'm going to leave this alone. And if you have any questions, send me an email, send me a link, send me your questions, and I will get back to you as an individual case. And I would also like to mention, I said it on a different, earlier in the video series, I am in the Dallas-Fort Worth area. If you want someone to actually come and sit down with you, I can do that. We just have to schedule it in. I only have limited spots throughout the day, throughout the week. We would just have to schedule that for me to actually come to your house. Other than that, we can use Skype or we can use email. It's totally your choice. If you send me a question or a comment inside the boxes, I will be able to get back a hold of you about that. Other than that, hopefully this series is helping you all out. The next series, of course, on the next page is talking about prescription drug plans. And you can watch these as often as you want. And also I'm going to be putting together a blog that's going to come out weekly with updated information. So hopefully this is all going well for you, and looking forward for your comments. Talk to you later. God bless.